Hi, today we're talking about implementation and evaluation considerations. This is in chapter 20, and this is a mini lecture. We're specifically going to be focusing on funding, and we're following the Open Stacks for Nursing textbook. In terms of our learning outcomes, for this section, we're going to talk about sustainability and how efficacy, value, and cost really help sustainability of a program, and think about some external, internal funding streams that can influence this program's funding and sustainability, and really talk about how to plan for this at the early stages. So, funding needs and program sustainability really should be addressed at the beginning and planning at the end of an initial funding cycle. So, to enhance sustainability by decreasing dependence on one single funding source. So, often programs evolve over time and have to adjust to changes in funding, as we've seen a lot lately, and also change to really support the evolving community needs. Things that can influence sustainability would be the efficiency and effectiveness of program activities, and also the community support. So, are there partnerships that can help maximize use of resources? Are there both private and public funding options? And is there an ability to draw on some new funds and partnerships? And all of these also should think about what the overall cost savings can be in association with the program, and then this evaluation piece of improvement and implementation and thinking about community needs. External and internal funding streams, we're going to be speaking about these particularly. So one is to identify funding support and really think about how to continue these community health programs or launch them. And it's like we said before, it's really necessary to think about funding coming from more than just one place. So grants, that is one place that funding can come. Indirect funding, so we can think about contributions or sponsored, government budgets, fundraising events, and even earned income. For sustainability and planning, this is really supported by program evaluation and objective achievement. So we went over kind of in different ways how we set SMART goals and looking at logic models and thinking about, okay, how is our program being evaluated and sustained? And so that oftentimes is associated with funding. There are budgets in different grants that are molecular, so you hit a milestone and then you get part of your budget. So efforts are strengthened when these programs demonstrate effectiveness, positive results, really strong leadership, and also that the community is engaged. When we think of both growth and stability, these are promoted when we incorporate that evaluation piece for this continuous quality improvement. We consider how the organizational capacity is growing and expanding, thinking about partnerships, and also starting to discuss some policy changes. And then continuously thinking about how to keep this going. So thinking about new funding streams and being able to identify what those are. So the NIH is a government funding stream. And we can see here in terms of both programs and investigators how this can play into funding research. So on an undergraduate level, you can think about becoming an appointee on an institutional board. If you were to go on and get a grad degree, then there are different funding mechanisms to support research and grad programs. And then post-grad, a lot of people then, after they get a doctoral degree, may then do a postdoctorate and do research with a very specific program aim and have very strong partnerships in there. And then early career, these are new professors. They have early stage investigator status, so 10 years post degree. And there's also to specialize in maybe a new area that's not specifically tied to graduate research. The K Award is one option. And then when we look into really this established investigator, then we're looking at these bigger funding options. So an R01, R21. And these are really where we're seeing long-term rewards, 3 to 5 years, bigger grant funding, and programs that then are initiated and evaluated that can make big changes within the research or other environments. When we're considering nurses in research, so one would be going through this progression of getting research in these different early stage investigator statuses or postdoctorate, or in the research program itself. And nurses can also work in the NIH and have roles and capacities there, specifically looking and helping with these different avenues. Really important when doing a research grant submission, we have to have a very strong specific aims page. There's a lot of guidance in looking at this step-by-step process, but it's articulating a very clear hypothesis and objective for the research, and this is the foundation for building an effective program and community intervention and getting grant funding for it.